Good afternoon. We would like to welcome you to the breakout session where we will be discussing improving voucher lease-up rates through partnership. Everyone attending this conference works really diligently to address ongoing housing and service needs for our nation's veterans. Through a great deal of effort, many communities have made significant strides to reduce veterans' homelessness and housing instability, and it's largely by partnering and bringing together resources. At this time, we'd like to just remind everyone that is participating that all participants are muted. There is a section in the webinar for Q&A where participants can communicate and put in information and questions. Also, there will be a giveaway of a gift card for participation to the participants at a later time, and winners will be notified by email. Finally, NCHV has done a great job with this conference, but as always, feedback is very helpful, and so they plan to have a survey that will come up at the end of this session that we would very much appreciate you complete. The impact of COVID-19, there's so many fears and concerns about the impact of the virus on physical health and daily life that contribute to or could contribute to the onset or worsening of existing mental health. And our veterans are certainly those that we would want to protect from that and to provide as much support as we possibly can. So today, we have a group panel that seeks to share just how valuable these partnerships continue to be, even more so at this time. We'll do some introductions. I am Deirdre Bolden, and I am with the Corporation for Supportive Housing. We are a national organization where our mission is to advance solutions that use housing as a platform for services to improve the lives of the most vulnerable, to maximize public resources, and to build healthy communities. I am a senior program manager where my supportive housing experience spans more than 10 years. I've worked with the Public Housing Authority in the City of Atlanta around compliance, annual reporting and planning, and managed their supportive housing program for 4.5 years. The rest of the panel will introduce themselves. We are very pleased to have with us 3 other representatives, 2 from from the Minnesota Assistance Council for Veterans, and then a representative from the Dallas, Texas VASH program. So if you will introduce yourself, Belinda, you'll go first, and then Nathaniel and David will follow. Thank you.
Hi, everyone. My name is Belinda Suttles. I'm one of the VASH supervisors with the VASH program in Dallas. If you don't already know, we are a permanent housing program for veterans, and we collaborate with our local housing authorities to issue housing choice vouchers to our veterans so that they can find permanent supportive housing in the community. Thank you.
Let's try this again. I'm Nathaniel Saltz, and I'm unmuted, and I am the statewide program director for the Minnesota Assistance Council for Veterans. We are a statewide nonprofit here in Minnesota with the mission to end veteran homelessness in the state. We do this with programs in the areas of housing, employment, and legal services, and have many of the same grants and funding sources of folks here that are on the call. SSVF and HVRP and grant per diem and kind of the whole menu and alphabet of funding sources that we focus on to end veteran homelessness. And with me today is David Nguyen.
Hi, thank you all for having me on. Are you able to see and hear me okay?
We can hear you but not see you.
I see. Okay. Well, I will work on my camera issue as we go, and but I am our Metro Housing team leader, and as Nathaniel had said, our organization is a nonprofit working throughout the state of Minnesota. We work very closely with our VA HUD-VASH partners and have been working very diligently to work with those veterans, specifically in particular to those who have vouchers, and are looking forward to sharing some of the ways and techniques that we've worked with our community to try and reduce the amount of time that those veterans who have vouchers are waiting to secure permanent housing. And that's all I have.
Thank you, David, and everyone. I am excited to be participating on this panel with all of you. And now we'll get into our agenda, what we are striving to share with you today. You can go to the next slide, please. We want to certainly provide information around, next slide, there you go, how communities and some of the best practices around advancing housing opportunities through collaboration. We will hear from Belinda regarding, if you can please mute yourself if you're not already muted, so that we can reduce the background noise, please. Okay, thank you. As I was saying, you will also hear from Belinda. She will share information around the HUD-VASH advocacy and stakeholder relationships and the impact that they're seeing in Dallas. And then finally, the team from MACV will be certainly emphasizing again how they engage with partners, manage barriers, and develop solutions. Next slide. So I'll be presenting just some best practices around advancing housing opportunities through collaboration. And I'd like to just share a little bit, next slide, with you about how CSH works in communities. CSH is a touchstone for new ideas and best practices. We are a national nonprofit organization that works across 4 lines of business. We have a training and education arm that basically enriches the industry and provides research-backed tools and training and knowledge sharing. We have a lending arm where we provide pre-development loans for supportive housing solutions. We have a consulting and assistance area where we collaborate and do a lot of community building and community planning using different innovations. And then we certainly follow all of the policies that are related to supportive housing and affordable housing and services. Next slide. Housing assistance aids individuals with limited incomes and or those who manage disabilities and have high ongoing service and financial needs. Robust and effective partnerships really help us to achieve our goals, to connect people to housing quickly. To leverage resources and enhance system capacity, communities can utilize outreach to and collaborate with groups working in the same space. Often it's helpful to identify, where with those groups where your goals overlap and where they align. And then once engaged, you're encouraged to create, collective training and other collaborative strategies to ensure that you have a similar framework. During, the initial engagement and kind of setting objectives, it's also important to consider the fact that nationally, Black, Indigenous, and people of color are highly overrepresented across far too many of our systems, especially in homelessness. And so we encourage every effort be made during the formation of these partnerships that you deliberately find ways to embed race equity while ensuring that the policies and processes that you plan together do not exacerbate inequity. Often our work reveals, again, that we serve the same clients across multiple sectors. So working together on those strategies will help to more effectively house and serve the high acuity clients. Under the service delivery and navigation, you want to enhance that the procedures are there in place to help the clients become document ready and to quickly lease up, once connected to a program. You'll hear a lot more about that from some of the providers on the panel today. And then finally, it is important that in all that we do, we overlay a housing first principle amongst the processes and our client interaction, lifting up the voices of people with lived experience where as much as you possibly can, and ensuring that the clients that you're serving, you're operating from their vantage point, enabling choice and non-conditional participation. In terms of the types of voucher subsidies, of course, there are a number of them, but I've highlighted just a few here that are very relative to the veteran population. You have, of course, the Housing Choice Voucher Program, where, that assists households with incomes below 50% of area median income, depending on the municipalities where they choose to live. And then, of course, you have the VASH voucher, which Belinda will share a lot more about a little bit later, that serves chronically homeless veterans. And then the mainstream voucher, which is a subset of the Housing Choice Voucher Program with the same income requirements, but it is designed to serve households where the head of household or the adult member lives with a disability. In terms of partnerships, that really can take on a variety of agencies and partner relations. We certainly find that interacting with the local public housing authorities in the realm of supportive housing overall is very, very key. Of course, working with your Veterans Affairs team, all of the SSVF providers in your community, and especially with the Homeless Continuums of Care, the COCs are really there to kind of bring about a lot of cohesion in the community to ensure that all of the providers that are working with the homeless continuum are operating within the coordinated entry system and framework. And then lastly, certainly we recognize that there is also a significant intersection with health, and so working with your public hospital networks as well as your healthcare for the homeless service providers is often very helpful. Next slide. The strategies around successful collaboration are multifaceted. In order to breed really committed partnerships at the onset, it is truly helpful and recommended that you come to a consensus of who does what, why, and how. It really will make for a much smoother implementation and continuation of that program, where you certainly will make adjustments along the way, but you're going to set basically, what the outcomes are that you're expecting to drive toward and who's going to be responsible for what portions of that. When it comes to program coordination, in the experience of the providers on this call and myself personally through my work at the Housing Authority, and really from what we've seen in other communities, establishing an effective time for the referral process is essential for housing programs to align the clients to the most appropriate housing intervention based on whatever your target populations are and eligibility. Frontline staff are really integral to the flow and expediency to move people into housing quickly. And it assists, these programs are going to basically be helping the individuals with startup and move-in costs and for their overall financial stability. So building in quality time to assess all of that and ensure that access to supported employment and other mainstream benefits are provided. Landlord engagement. Landlords, units, as I often say. We can't do it without having them. And so those are essential relationships to this process. Many landlords have learned more about supportive housing over the years, and others still need education and need to be connected. And so really helping them to understand the population, helping them to promote utilizing minimal barriers to housing, and helping them to understand the work and the impact of their role within this system. Developing the rapport and having open lines of communication with property managers, really contributes to the tenant's housing stability and gives the landlord a peace of mind as well. And then certainly when it comes to any program like the VASH or any other supportive housing program, evaluation is a necessary part of that process because it allows you as the program administrators to understand how well you're making progress towards the goals you have set. It allows you to have some common goals that relate to each of the agency's missions and reflect that, of course, within those partner agreements, those formal agreements. It's important to also determine reporting intervals as well, whether you're going to be doing that on a monthly, quarterly, or annual basis. And it can continue to spur momentum. Analyzing these outcomes really demonstrates the impact of resource investments to not only to you as the program admins, but to your leadership and, of course, to the broader community. So, many use evaluation on an ongoing basis, and some PHAs are actually utilizing the HUD Homeless Management Information System as well to create a way to have reporting and drive progress towards those targets. So at this time, we'll turn it over to Belinda, who will share again more information about the Dallas VASH program. Next slide, please. Belinda?
Thank you, Ms. Bolden. So first, I'd like to begin by giving a brief overview of the VASH program. We are a housing and case management program where the VA collaborates with local public housing authorities to house veterans that are homeless and that also have a case management need. We follow the housing first model, like Ms. Bolden mentioned earlier. The VA identifies the veterans that are eligible for the program and makes referrals to the local PHAs, and the local housing authorities issue and manage the vouchers while the VA provides case management and other supportive services. Next slide, please. I am going to speak about some of the successes with our lease-up rate as a result of advocacy and partnerships within our community. But first, I wanted to begin by giving an overview of the state of homelessness in the Dallas area. One of our key partners in the community, the Metro Dallas Homeless Alliance, facilitates a homeless point in time count for Dallas and Collin counties annually. They are able to get volunteers from our homeless continuum of care and various organizations in the community. This slide reflects how many veterans were identified as homeless in 2019 and 2020. Of the 431 veterans in 2019, 81 were chronically homeless, and of the 360 in 2020, 56 were chronically homeless. This data is typically used to determine what resources are needed in our area. Next slide, please. These are some of the key agencies and partners that we work with within the community. They all play an integral part in providing services to our homeless population and assisting with housing our homeless veterans. Metro Dallas Homeless Alliance, the SSVF programs, of course, City of Dallas, landlords, local shelters, and just various community agencies, churches, even just like Catholic Charities, different organizations that assist with rental deposits and various financial resources that our veterans may need when it comes to moving into an apartment. Public housing authorities, HUD, and of course our local homeless continuum of care. Next slide, please. As an agency, sometimes it can feel like, or at least sometimes to me, it can feel like you're working in a silo independent of all the other community agencies. But you're also all working to accomplish the same goal. So to combat this and to help us to accomplish the goal of housing homeless veterans, we understood that we needed to focus more on a team approach by being more involved with our homeless continuum of care. So in order to accomplish this, we have bi-weekly meetings where we discuss veterans identified on our by name list. And the by name list sorts our veterans based on prioritization in the VSPDAT score. Prioritization is determined by the length of homelessness and case management need. Currently, we have about 44 veterans on our by name list. Veterans during those meetings are referred to either permanent supportive housing program or a rapid rehousing program. Our program also has bi-weekly meetings with our SSVF providers to discuss veterans that are receiving their services while waiting on the VASH voucher. And these meetings have been very beneficial, especially during this time period, during the pandemic, when a lot of agencies have been closing, have been closed to the public, and which kind of places a barrier to some of the services that our veterans have access to. So the VA and the HUD-VASH program being more actively involved with the other agencies in the community, our veterans, continues to give our veterans access to those services because we're able to advocate on their behalf. We're able to provide them with information about the status of, their referral to the SSVF program, or if they're currently housed in a shelter, and we can communicate with them about their status there. Next slide, please. The purpose of our meetings with the Homeless Continuum of Care, it helps us identify veterans that are homeless in our community, helps us to assess them to determine what needs and resources would best serve them. We're able to make appropriate referrals to community providers, and we're also able to determine the services available by each agency. And what I find to be really important is this last one. It's just being able to share best practices with each other, especially when we have a veteran that's difficult to engage. It might be difficult for one agency to make contact with that veteran, but it may be easier for us to make contact with them. So it's really important and has been very useful to be able to meet with all of the agencies within the community, within our continuum of care, to ensure that we're able to meet our veterans' needs. Next slide, please. Benefits of working closely with our community partners. It improves our communication, and communicating with our key partners is an integral part of why we have experienced success with our lease-up rate, because we're able to share ideas, and we also have more of an open dialogue with them even outside of the meetings. If we need information about a resource or have a particular veteran that we would like to refer to a certain agency, there has been an increase in communication. It increases veterans' access to appropriate resources. It avoids the duplication of services. And we also have learned to work together better as a team to address a common goal of housing our homeless veterans. Next slide, please. So next, I wanted to kind of talk about a little bit about what we have been able to accomplish with our continuum of care. In 2019, the Metro Dallas Homeless Alliance, along with one of our public housing authorities, Dallas Housing Authority, and the VA, we were able to work together to have a challenge where we challenged ourselves, we challenged the community providers to house 100 veterans in 100 days. We were able to exceed that goal. We were able to house 140 veterans within 100 days. This initiative was a response to the January 2019 homeless count, where the number of homeless veterans increased by 100 from 331 to 431. To me, this challenge really showed how everyone was able to come together and work as a team. Dallas Housing Authority hosted landlord fairs to, get more involvement from our landlords and to also identify housing that was readily available for our veterans once they received their voucher. Attempts were also made to hold document fairs to assist veterans with securing the needed documentation for their referral to the Housing Authority. Our VASH team was really excited about meeting this goal and this challenge. Our housing specialists and social workers focused on fostering and maintaining relationships with their current landlords, as well as developing relationships with new ones during this time, so that they could help our veterans with finding housing. This is also something that we plan to continue to do. We had started a homeless challenge this year to house another 100 veterans within 100 days, but that was kind of interrupted by the pandemic. But I know it is something that we will try to do again in the future. Next slide, please. I also wanted to show what our impact is to some extent on the community. As a program, currently we have about 184 vouchers, and we work with 3 different public housing authorities in our community. We work with Plano Housing Authority, Dallas County, and the City of Dallas, but majority of our vouchers are with the City of Dallas. When our program initially started, HUD and the VA developed ways to measure and monitor the effectiveness of our program. So as you can see, we're either meeting the measure or exceeding the measure, especially with our lease-up rate. Our measure for our lease-up rate is 94%, but currently we're meeting it at 95%. And we wouldn't be able to make this level of progress if it's not for the partnerships we have built in the community, and the level of advocacy that's available within our community. And I'll speak a little bit more about that later on. Next slide, please. Despite the progress that we have made and the partnerships that we have built in the community, we still face some of the same challenges that probably a lot of HUD-VASH programs face, which is changes in the housing market and veterans with criminal backgrounds and poor rental history. But we have some programs and incentives available that can kind of help address those at this time. Dallas Housing Authority offers a landlord incentive bonus of $500 to each landlord that rents to our veteran with a VASH voucher. Now, that doesn't cover all the vouchers that we have, because the other 2 public housing authorities that we work with, they don't offer this incentive, but it does cover majority of our vouchers. And it's a great program. It doesn't require a lot from our landlords. They only have to fill out a 1-page form and submit it to the housing authority when the request for tenancy application is submitted. So it's an added perk for a lot of our landlords when they're able to receive an additional bonus for renting to our veterans. And it also, to some extent, shows them that the housing authority appreciates their willingness to work with our veterans. We also have a great team. We have a housing specialist, peer support, and social workers. We have a housing team of social workers that their primary focus is to help our veterans find permanent housing. And they advocate on behalf of veterans that have poor rental history and criminal backgrounds. And they have built relationships with landlords in our community, so they know if they have a veteran that has a barrier, they can present it to that landlord, and he or she may work with them just based on the relationship that they have built. One of the key partners that was discussed earlier, Metro Dallas Homeless Alliance, they also host landlord appreciation luncheons annually to just show the landlords in the community that work with our homeless population in general that we appreciate them. And this is something that the VASH program has done as well in the past. We have hosted landlord appreciation fairs to recognize the property managers that work with our veterans. Next slide, please. Well, the next slide focuses on local supports that are available for voucher recipients in the Dallas area. The City of Dallas passed an ordinance in October 2016, amending Chapter 20A of the Fair Housing City Code. This was very beneficial to our veterans because it prohibits discrimination based on sources of income in the sale or rental of housing. And that income includes Social Security, any type of disability payment. And it also requires that housing providers that receive city funding to accept housing choice vouchers, and they have to set aside at least 10% of their units for housing choice voucher holders. And this was definitely a very good tool for our staff to use to advocate for landlords to begin accepting the voucher. I will admit that it wasn't always easy, especially, establishing relationships with new property managers. But when they were educated about this information, if they didn't already know, they were willing to work with our program. In addition to the ordinance, there is also another program or nonprofit organization within our community that has been very helpful to our VASH clients. It's called the Inclusive Communities Project. It's a nonprofit organization that works to ensure that low-income families have access to affordable housing in high-priority areas. They are able to provide assistance with application fees as well as rental deposits if our veterans choose to work with their program. A representative from their program is present during all briefings with Dallas Housing Authority to ensure that each voucher recipient is aware of their services. And it has been really beneficial because sometimes our veterans feel that they may have to go to a high crime area just because of their background or because of their rental history. And this program kind of helps them understand that despite their situation, it is possible for them to pursue housing in a higher low poverty area.
Belinda, thank you.
Next slide, please. Next slide, please. Oh, I'm sorry. So in conclusion, I just wanted to say that our work is not finished here. We will continue to work on building relationships and partnerships with the other providers and within our community to ensure that our veterans are able to secure stable housing. And I truly believe that other HUD-VASH programs and permanent supportive housing programs within the community can mimic, some of the things that we have done as far as, becoming more involved with our continuum of care, establishing challenges within the community to challenge other organizations to focus on housing our homeless veterans. Thank you for your time.
Thank you, Belinda. It really seems like you all are doing fantastic work. And so now we'll move on to Nathaniel and to David with MACV.
Thank you. This is Nathaniel Saltz, the Program Director with Minnesota Assistance Council for Veterans. And next slide, please. Which is very similar to what you just saw on the last slide. I'm Nathaniel, and David will be joining me in the presentation. So the overview of what we'll be talking about are who are the key partners to improving our voucher lease-up rates? What are the barriers and challenges to housing veterans that have a voucher? What are some of the things we've done to overcome these, and the roles and responsibilities of us and our partners? It's heartening to hear that so much of what we're finding effective is also being found effective in Dallas and nationally. a lot of the challenges that we see are all the areas where there can be a breakdown in communication between the time when we've identified a unit and at the time when a veteran moves in. So we're talking about communication breakdowns regarding inspections, the RFTA forms, deposit payments. So great, here's we'll give this veteran a lease. No, we can't have a lease. We need an intent to rent. And so this can be extremely confusing for the landlord. The vacancy payment reimbursements that we have in our community, move-in costs, utilities, furniture, and then all of a sudden, a week after the veteran moves in, there's a dog and 3 cats in the apartment that the landlord didn't know about, and 0 litter boxes. And so here's another communication breakdown that we need to address as well. Next slide, please. So the key partners, of course, are the landlords and the property managers. Number one, as this is, we need them for these units so that we can house our veterans. A committed veteran services provider. With us, MACV, we have SSVF and grant per diem. It doesn't necessarily have to be one of these funded sources, but a service provider within the community that's focused on veteran homelessness and focused on this mission. Of course, the VASH program in Minneapolis, it's a CRRC. We work with 3 other VAs as well within the state of Minnesota and partner with them throughout the state. The housing authorities, we have a veteran registry by name list, which is operated by our Minnesota Department of Veterans Affairs. So the partners that are on that are critical to this work of increasing the voucher lease-up rates. And then we have a landlord mitigation fund, which has 3 components to it. There's an incentive fund for veterans that have significant barriers to getting into housing. We have a mitigation fund for damages that are caused as an insurance policy for landlords, and a what is it called? It's the vacancy fund, vacancy relief fund. So while waiting for an inspection to occur, that a landlord is not losing out on rent. And that also is administered by our State Department of Veterans Affairs. If you're looking for ways to engage your State Department of Veterans Affairs in this work, reach out to Minnesota's Department of Veterans Affairs. They are highly active and involved and doing some very creative work on that. Next slide, please. So I was messaging with David before this. I'm like, my goodness, they've got their information. They're outstanding. They're a lot of the same information, and I've got a duck. He's like, it's okay, Nathaniel, it's all right. So the duck on this slide is the landlord. So what are the barriers and challenges to a landlord housing a veteran with a voucher? Oftentimes, landlords have been treated as an obstacle to be overcome by service providers. They've been made to feel like they're the bad guy when there are issues and they're needing to focus on lease compliance. One of the things is not having clear roles with all the partners. So having all these partners is wonderful. However, who does the landlord call and for what? And generally, it's not going to be for this lane, I need to call this person. For this lane, I need to call that person. I call, if I'm a landlord, I'm going to call the person I know is going to call me back. And so this type of coordination of the service providers is critical. Feeling dumped on, manipulated, some service providers withholding information, and then when this information comes out, not being able to be found, or kind of covering their mouth and covering la 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 la, not my problem. A lot of programs speak as opposed to landlord speak and business speak and property management speak. There can be a perceived cost that veterans that have a voucher are going to be more expensive to house because of unpaid costs, rent that's not paid, damages to the unit, waiting for the voucher to go through the administrative time of filing the RFT, all the forms in, and making sure everything's getting done on time. There's a concern about angry neighbors. As a service providers, we tend to kind of brush this off as, oh, it's more, here comes the NIMBYism again. And we have to also be considerate of, for a landlord, these are their paying customers, and these are people that have been residents in their building for a long time, and they're concerned about how changes are gonna impact them. So be able to speak and address concerns with landlords. And then of course the confusing housing authority requirements and documentations. that often comes with very little customer support. Next slide. And to talk about these, here's David.
Hi, thank you. So a lot has been said on the partnerships and how those partnerships work together with the same goal. One of the things that I wanted to talk about are a couple of the specific things that we've done in the Minneapolis region here in Minnesota. And I think the overarching piece to the technique that we've used is that in our Minneapolis area is more urban. And so our strategy as far as working with the landlord, our VA partners, the housing authority, might look a little bit different depending on where you operate. If you're listening to this and you're more of in a rural area, there are still ways that if what we have done, which I will share, can be helpful for you. But I think the big thing that we have focused on is providing customer service for the landlord and helping the landlord and helping our agencies facilitate communication on behalf of the landlord to expedite the administrative process for veterans who have a HUD-VASH voucher. And so the goal of all of this, of course, is in working with the landlord to ask the landlord to be more flexible on the resident selection criteria, because as we know, veterans who have a HUD-VASH voucher, it's not necessarily a free pass into housing. Landlords are also screening for certain things. And if we have veterans that we're working with who have justice involvement, who have poor rental history, who have poor credit, these are also barriers that we encounter. And on some cases, we've had landlords say to us, you know, hey, we talked about that veteran and obviously there's some concerns there, but we are willing to give this veteran a chance based on the fact that you guys are so good to us. And so that's our goal, is to foster and maintain these relationships with a customer service orientation towards the landlord's needs and maintaining the veterans' housing stability. So formal contracts, we do have memorandums of understanding with certain landlords that have a large number of units. And these landlords, the formal contract outlines what MACV will do for them, and in return, what the landlord will be flexible on for us. Ideally, we would like to foster our top 5 landlords and discuss our top 5 landlord relationships and how we are supporting them through good customer service. So we do have a top 5 here in the Minneapolis office, and our top 5 landlords with those units and their willingness to be flexible on those units has been key for us to reduce the amount of the voucher lease-up rates. And so the MOUs have been a tool, regular site visits. And so my perspective on this is that I'm our Metro team leader. And so I'm in the middle between providing the frontline direct service, managing our case managers who provide the frontline direct service, and then, but I'm also in a supervisory role. And so I say that because when we first started with one of our bigger landlords right now, it really started off as a site visit with just me going to talk with the landlord and finding out what was going on, only to discover that the landlord had multiple balances for veterans that we had paid the deposit to move in on, and they were still waiting on payments from the housing authority, or they were waiting for an RFTA form to be sent to the housing authority, and or the housing authority was waiting to receive a document so that they could do the inspection. So these are the challenges, as Nathaniel had mentioned. I think the slide got rotated backwards. Thank you. Right. So and so that goes right into our next slide, which is the customer service piece. All those things that I had mentioned are things that occur in silos. What I mean by that is that the housing authority might not have the RFTA form unless sometimes we've asked for it and they've told us they didn't have it. When we're talking about the volume of veterans that we're working with, these types of communication pieces, days or even weeks can sometimes go by before someone follows up and says, oh, right, no, I never got that. Oh, I thought I sent this document on this date. Oh, I guess I didn't, or it wasn't received. And so a big thing for this is how could we improve the flow of communication between the housing authority, the landlord, our VA partners, and MACV? And probably a big piece to this, which is on the next slide. If you could go to the next slide, is our outreach. And so it was mentioned on here, but I'll describe it. We do go to the landlord's place of operation and actually sit with their with the landlord and actually review the names of the veterans that we've moved in or are working to move in on a name-by-name basis. And during this conversation, our VA partners actually join MACV, and we log in and actually talk with the local housing authority, Minneapolis, Metro, and we actually go through a checklist for each of the veterans' situations. Has the lease been signed? If the lease hasn't been signed, what's the lease signing date? Has the RFTA form been submitted? Has the RFTA form been received? Has the inspection been set up? What date is the inspection? And these kinds of conversations, which take about 5 minutes for the veteran to line up these items, eliminate all the back and forth, and ultimately have resulted in us being able to really seamlessly move veterans who have HUD-VASH vouchers into permanent housing through a controlled multi-agency visit with the landlord. Next slide, please. So this is the slide that I had mentioned. It does streamline the flow for veterans who do have vouchers into permanent housing, and it also takes the burden off of the landlord, who has to, before this, track the flow of documents for multiple veterans. I can't tell you how often I've had landlords before our multi-agency site visit with the landlord, where they could have swore that they thought they sent the RFTA form for a veteran to the housing authority, only to find out that it was for another veteran, because they have 5, 6, 7, 8, 9 veterans that they're working with us on. And so for us to be able to help them and control that administrative pipeline has been hugely valuable for us in the Minneapolis area in Minnesota. Next slide, please. I don't see the slide. If you could move it to the next slide. There we go. So this is our team. It is multi-agency, and our relationships with our VA partners, housing authority partners, and the landlords have never been tighter. We have each other's contacts. And I feel like a year and a half ago, before we came together as closely as we did, these silos and where documents could get hung up resulted in a lot of frustration, and also could result in negative ledgers or rental balances, and also people thinking that other people were going to pay and they weren't. And so our housing authority is crucial for what we do and how we communicate. We've received a number of emails from our Minneapolis housing authority, and Chris at our housing authority is like, this is fantastic. We really appreciate you guys communicating with us, staying on top of these issues with us. And the landlord really is now able to focus on just working with the individual veteran as far as the selection of those veterans and maintaining their units to make sure that they can pass inspection. Next slide, please. And I think Nathaniel had this slide.
Yeah, and so these are the roles of our agency and the VA. I think the real critical thing is between MACV and the VA is it's not, this is our veteran, this is your veteran, this is your mistake, not our mistake. It's really understanding that in spite of the funding sources trying to create really strict swim lanes as far as who does what, that the veterans we're working with and who they're working with is much more fluid, and there's a lot of overlap. I know out of the 166 people in the room right now, a couple are probably SSBF grant officers, and so we coordinate. I think just recommend coordinating the roles and duties if you're an SSBF grantee with the grant officer, because we all are sharing the same mission of ending veteran homelessness, and if we need to find leveraged funds for these projects and making sure that we're all kind of on the same page, it's that partnership that we see over and over that works to house veterans and to reduce the recidivism into homelessness.
Well, thank you so much, David and Nathaniel. We do have just a few more minutes left in our session, and I'm going to go straight into some of the questions. Thank you to the presenters. There's one question that is asking related to the incentive payments to landlords around what the funding is, and how can you entice landlords in the community where a city doesn't have these kinds of resources. One thing that you will make note of right now in the time of COVID, HUD has basically released through the Emergency Solutions Grant, or the ESG program, some waivers that are giving a lot of flexibility around being able to create some landlord incentives in the community. So I encourage you to reach out to your entitlement and even your non-entitlement ESG partners. Many times that's the county or the state, and in some cases they subgrant those to the COC or to providers. But they have some flexibility now around funding to do some of these landlord incentives. There's another question for Belinda. How did you get, actually about the breakdown of your team? So could you talk about how your teams are broken down? Do you have phases? Do you have a housing specialist, an intake specialist, or a case manager? Does your peer support do only food deliveries or driving to and from appointments? I think they wanted a better sense of what your staff is actually doing at the Housing Authority.
Okay. So our staff within the HUD VASH program, we have social workers, peer support specialists, we have 2 nurses, a physician assistant, a housing specialist, and we have vocation specialists. We have 2 vocation specialists. So our social workers, they provide the case management services. They go out and visit our veterans in their apartments once they get housed. But we also have a housing team, which consists of 4 social workers, and their main purpose is to help our veterans with securing stable housing in the initial phases when they first get admitted to our program. Our medical staff, the 2 nurses and the physician assistant, they help our veterans navigate any medical related questions, like if they get diagnosed with diabetes and they have questions about that diagnosis, or if they have trouble communicating with their primary care providers, our medical staff assist them with that. They assist them with medication management. If they need help with wound care, that's something that they can help with as well. Our physician assistant can also prescribe medication or help them with getting their medications refilled, help with CWT referrals, and things of that nature. And our peer supports, they're not confined to just doing food pantry runs. That is something that they can assist with, but they also facilitate groups. They have mental health groups. They also facilitate SUD groups. They do help with transportation to medical appointments if needed, or to a food pantry if needed. They are essentially supports to our social workers, and they advocate on behalf of our veterans. It just kind of depends on what their level of expertise is. Like one of our peer supports, he's very familiar with applying for benefits. So he's always the person that our veterans will go to ask those questions if needed. We have 2 vocation specialists. Oh, I'm sorry.
I'm so sorry. Yeah, we just wanted to give Nathaniel, there's a question directed to Nathaniel and David, and we're just running so short on time. I apologize. How are you conducting your landlord conversation meetings with less operations in person? What ways are you doing this now with COVID?
If I may, I go there, just me, and turn on my Microsoft Teams and put the computer in front of the landlord, and members of multiple agencies will pop onto our Microsoft Teams, and it's like they're in the room, the camera and everything. It's pretty cool.
Okay, great. And then Nathaniel, someone wanted to understand, how is your organization funded? I think that'll be our final question.
Sure. We have a number of government grants, HVRP, SSVF, grant per diem, some HUD grants through the COC. We have state funds through our Department of Veterans Affairs, as well as foundations and private donations. So we're nonprofit, and all the work that we do is around veteran homelessness. So it's a cross between government funds about 60% and then non-government funds about 40%.
Okay. And it looks like we do have a little bit more time. Someone had a follow-up to my information around the Emergency Solutions Grant. Again, that is a federal grant that is distributed from HUD. And because of the CARES Act, they have released financial resources through allocations to local communities. You can go on to the HUD website and just type in Emergency Solutions Grant or ESG, and it will certainly give you more information about it, but it is funding that local county governments, city governments, are receiving, so that they can either utilize that in the programs and services that they administer directly, or many times they sub-grant those funds to other organizations in the community that are able to administer, sometimes through an RFP process that it's done, and sometimes not. Actually, right now, HUD is waiving the need to do a formal solicitation. If they already had ESG programs in place with providers, they can just extend those agreements. And then lastly, I think that there was one other question about, I apologize, let me see. Oh, the landlord fairs, and how you all go about planning those. Can you tell more about those? And I think, Belinda, you have those as well, correct? Or is it just?
Yes, it was kind of, they're more so facilitated with the help of Dallas Housing Authority. We had them during our 100-day challenge, and we basically invite landlords to the briefing on the date that the veteran is going to receive his or her voucher. They bring applications so that our veterans can go ahead and complete the applications once they receive their vouchers.
Okay. Well, excellent. And then there's one last question. How are you able to get your housing authority to become so involved in the housing process? Any advice on how to get unwilling PHAs to participate in landlord engagement and the incentive program? Anybody want to tackle that one?
I mean, I can say, at least for us, it was really just old-fashioned, because I remember very clearly when I went into the landlord's space of operation and saw the ledgers and where everything was not coming from, and trying to connect all these dots. And for us, at least, it really became just who's the person at our housing authority that handles our HUD VASH, and literally just reaching out to them and saying, "Hi, I'm David."
Yeah.
I'm David.
Yeah.
I think that's easier with smaller housing authorities. Like, we work with 2 smaller housing authorities, and only one person manages our HUD VASH vouchers at those smaller housing authorities. so it's easier to communicate with them. But at our larger housing authorities, there's multiple people that manage our vouchers because we have over 700 vouchers with them. So sometimes it can be difficult, I will say, with the communication at times. But we are able to communicate directly with the supervisors if there is an issue. So they typically are very good about resolving it.
Mm-hmm. And from my housing authority experience, I would say that it is definitely advantageous really to the PHA around their utilization. HUD monitors their HUD VASH utilization, and if you certainly cash it from that perspective, that developing this partnership and these relationships, it helps them, to ensure that they're getting connected eligible veterans to utilize their vouchers, and it's a win-win for everyone. So thanks. Go ahead.
Ms. Bolden, I wanted to add one more thing. I'm sorry, I'm long-winded sometimes. But another thing that I found, and I forgot to mention, that's helpful for our larger housing authority is that we have 2 supervisors within our program. So one of us will have a meeting with that housing authority every week to address any issues or concerns, any questions that our social workers have about our VASH veterans so that we can get them resolved and have kind of just a way of communicating with them, especially if we can't reach them, and especially during this time because some of the housing authorities are still close to the public. So that's been really helpful for us.
Mm-hmm. Okay, so just a reminder that there will be a survey at the end of the session. Also, the gift card giveaway, so be on the lookout for that. For those that were participating throughout, we certainly appreciate your attention and your questions today. It's been a pleasure working with all of you, Nathaniel, Belinda, and David, on this panel. And we greatly appreciate Jasmine and David Higgins in the background with the National Coalition supporting this panel. And we hope that you found some of these best practices that we've highlighted helpful so that you can certainly go out and build strong partnerships that will serve your veterans in your communities. Thank you so much, everyone.
Thank you.
Thanks.